This video is going to be covering portions of the lumbosacral plexus. In particular, I just want to talk through a few of the pathways of the lumbosacral plexus so that you can understand a little bit better where these nerves are running to and why it makes sense, the muscles that these nerves innervate. I won't ask you to be able to draw this one in the same way I'll ask you to do the brachial plexus, which is why I already have these images pre-populated. I just wanted to go through a few of the pathways and talk through these, okay? So up first, just to orient you guys, so on the left side here, we have an anterior view of the lower half of the body into the abdomen up here. And then on the right, we have a posterior view. Okay, posterior. And then knee and ankle, I wrote them in knee and ankle. I know these drawings aren't the best, but hopefully they'll do. So, again, I'm going to be operating off of this lumbosacral plexus, term sheet. So, and we'll roll through as many of these as we can. So, the vertebral column would be running down just here in the middle. So what we're going to do is off of the vertebral column, we have several nerves that are going to run up here, and they're going to kind of cover through the abdomen. And you'll see that because of their names, okay? So subcostal, again, listen to the name, subcostal. What does that mean to you? Subcostal, below rib. So we have the subcostal nerve into the iliohypogastric, ilioinguinal, and then finally the lowest, lateral femoral cutaneous. This landmark here would be the ASIS. I'll kind of write that in here. ASIS, because that lateral femoral cutaneous, as it comes down, it's going to come down this way. My ASIS is right here. It's going to pop out about the ASIS, and it's going to innervate my skin here on the lateral femoral region. Hence the name lateral femoral cutaneous. Okay? So ASIS, I have the inguinal ligament in here. Now, inside of the abdominal cavity, okay, so where the bladder kind of sits and in deeper, we're going to have ventral rami. You'll recognize that from the brachial plexus video. We have ventral rami that are a part of the brachial plexus, the exact same, we have ventral rami which are a part of the lumbosacral plexus, the exact same as the brachial plexus. So, for example, we have L4, L5, S1, S2, S3, and S4. These are the ventral rami of the lumbosacral plexus. L4 and L5 are going to combine to make the lumbosacral trunk, and then S1, S2, S3, and S4 will be their own standalone ventral rami as they come on out. Okay. Additionally, you'll see this on some videos and some images as we get into class. The psoas major is going to sit right here, coming off of the vertebral column, and so a lot of these, the femoral nerve here, the obturator nerve, some of these subcostals, we don't actually see those until they come out from underneath that psoas major, and I'll give you some visuals on that. Okay, so we've covered that top portion. The femoral nerve is going to come down and run right out here, and then the femoral nerve is going to come, and once it passes this inguinal ligament, it's just going to branch out. Okay, so on the anterior region, okay, so we're coming down here into the anterior thigh, and then two branches off of this femoral nerve. We have the anterior femoral cutaneous nerve and the saphenous nerve. Notice I have the saphenous nerve coming all the way down into the medial portion of the ankle. The saphenous nerve is a cutaneous nerve, and it comes all the way down into the medial portion of the ankle. So two branches of this femoral nerve, anterior femoral cutaneous and saphenous. Finally, on this anterior view up here in the lumbo trunk, we have the obturator nerve. So the obturator nerve, again, it's going to come, it actually kind of cuts across this abdominal cavity, and it's going to come and pop out, and it makes its way into the medial portion of the thigh. And I have a bunch of these muscular branches coming off right here, because this obturator nerve is going to innervate these muscles of the medial region of the thigh, our adductors, adductor longus, adductor brevis, etc., adductor magnus. It's going to innervate these muscles of the medial compartment of the thigh, as well as a small skin portion on that medial thigh. Okay, so that's a few of the pathways here of these anterior view nerves. Okay, so saphenous coming down. We have femoral. I mentioned obturator. Femoral is going to innervate the anterior component of the thigh. Okay. Now, I'm going to move into the posterior. I'm going to move into the posterior lumbosacral plexus here. Okay. So an important landmark in this posterior lumbosacral plexus, I drew in the piriformis muscle. Okay, I drew in the piriformis muscle. The piriformis muscle will be an important landmark because we have muscles that come out inferior to the piriformis, and then we have some nerves that come out superior to the piriformis. And so I drew in that piriformis because it's an important landmark. Superior to the piriformis, we're going to have the superior gluteal nerve, and that's going to innervate the musculature along the superior gluteal region. We'll get to that. Inferior to this piriformis, we're going to have this sciatic nerve come out along with the inferior gluteal nerve. Okay? The sciatic nerve is the biggest nerve in the body. It's huge. It's actually a encased two nerves. Okay? So as we make our way down, we're going to split into two nerves, and I differentiated them with the colors here. It's going to split into the common fibular. I drew one branch out because the common fibular is going to innervate one muscle here in the thigh, and then the tibial is going to continue on down through the entire posterior region of the leg. And when you look at muscles that are innervated by the tibial nerve, you will notice that this posterior region of the leg and the thigh, tibial, 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 tibial. Okay, so many. Additionally, we're going to have a posterior femoral cutaneous, which is going to handle the skin innervation of the posterior thigh. Okay, just like we have an anterior femoral cutaneous, we've got a posterior femoral cutaneous. Now, so let's start with common fibular. So common fibular is going to come down. It's going to innervate one muscle in the thigh, and it's going to come down right towards the head of the fibula. And then it's going to dive anteriorly at the head of the fibula and split. Hence the name common fibular. Why is this nerve called the common fibular? Because it's going to deeper down split into distinct nerves. So above we're common, but below we're specific. So common fibular goes to head of fibula, and then it's going to separate into a deep fibular nerve and a superficial fibular nerve. Deep fibular nerve is going to run along this anterior compartment of the leg, through the top of the foot, down to the first web space, in between that first and second digit. Superficial fibular is going to stick to the lateral compartment. So the muscles of you can think muscles of the lateral compartment. What are they? Oh, well, that's fibularis longus and fibularis brevis. Guess what innervates fibularis longus and fibularis brevis? The superficial fibular nerve right here. Okay, and then we're going to have a cutaneous portion as we come down into the lateral portion of the foot. So this common fibular gives rise to both of them, and you'll notice that the entire anterior and lateral leg are innervated by this common fibular down into the deep and superficial fibular. Okay, so femoral muscularly does not cross the knee. What happens is common fibular comes and wraps around to cover that. Okay, now let's come back over to this side with the tibial nerve. I already mentioned tibial nerve is going posterior, 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 and inferior, inferior, inferior. And finally, at the bottom, it's going to split into three branches. The calcaneal branch, which provides some skin innervation. And then we're going to split into a medial and lateral plantar nerve. And the medial plantar nerve is going to go to the medial side of the foot and innervate muscles of the medial side of the foot. And the lateral plantar nerve will go and do the lateral portion, lateral musculature of the foot. So tibial nerve is a huge nerve that comes on down. Finally, maybe I'll make note of this. So I already mentioned cutaneously, we have the posterior femoral cutaneous, which does the posterior thigh. But what about as we move down into the sural region? And I use that name very specifically, the sural region. Off of the common fibular and the tibial nerve, we give rise to two branches. This branch is going to be the lateral sural nerve, and this branch over here will be the medial sural, just based off of its directionality. When those two combine, they become the sural nerve. And the sural nerve provides cutaneous innervation into the sural region of the body. Remember, sural meaning calf, sural meaning calf. So the sural nerve covers the sural region of the body. And I believe that covers the pathways that I want you to know. Again, you don't have to be able to draw this one in the same way that I want you to do brachial plexus. However, I do think it is helpful if you are able to have a a rough idea, understand these pathways. Draw it if you need to. Understanding where these nerves run and what they, where they get to will help you tremendously when we get into musculature and skin innervation. Okay?